finish this elbow series with dynamic maneuvers. The elbow is particularly well suited to such dynamic maneuvers during ultrasound imaging, either to explore the normal anatomical structures or to test its stability. The first maneuver I want to describe will show how the radial head rotates at the level of the proximal radioulnar joint. Here is the starting position. The radial head, we can see the cartilage, the annular ligament, and you can also see the branches of the radial nerve. All you need to do is gently rotate the patient's forearm back and forth. This is particularly useful to identify fractures. On the screen, you'll see an example of this pathology with a small linear hypoechoic structure. When we add movement, you can see that this structure moves, which corresponds to a radial head fracture. The second maneuver, which is called the COBRA maneuver, will allow us to take an inside approach, like you see here, and to analyze the biceps tendon. Here is the biceps tendon at the level of its insertion on the radial tuberosity. And here it goes. You can put tension on it, then turn it. It's a bit like MRI slices during elbow flexion. Just in front of this biceps tendon, you can clearly see the brachialis tendon, which does not move during pronation-supination movements. The COBRA maneuver can also be used to evaluate the posterior portion of the proximal radioulnar joint. You can see here the rotation of the radial head, the annular ligaments, and the ulnar, which can be relevant to assess sequelae after a sprain. With this third ulnar maneuver, we will test the stability of the ulnar nerve in the medial compartment. We start in relative extension, then gradually flex the patient's elbow. You can see that the triceps becomes taut, but in this specific case, the nerve remains stable behind the medial epicondyle. This is an example of ulnar instability at the elbow. You can see that the ulnar nerve is behind the medial epicondyle and then will sublux forward along with a portion of the triceps. This is a snapping triceps, which is a normal variant in this case. We will now test the stability of the medial ligament complex using dynamic maneuvers. You start in the longitudinal plane in the long axis of the tendons and media ulnar collateral ligament. By doing valgus movements like this, you can see some ligament laxity in this young female patient. There are micromovements, but they are considered physiological. This is an example of medial elbow instability. There is obvious gapping here during forced valgus movements in this judoka who has suffered multiple sprains on the medial side of her elbow. It is more difficult to test lateral stability. One of the tricks that I like to use is a pad to lift up the elbow. This allows me to do varus movements like this. You can see here that in this young female patient there is no gapping and the radial head is perfectly stationary. You can see in this pathological case of a patient who has suffered multiple sprains on the lateral side of her elbow, the subluxation of the radial head. A severe sprain of the lateral compartment will cause posterior instability of the radius, which can be detected using the following maneuver. Here is a sagittal section on the joint line. Press your thumb on the radius and try to sublux the radial head and radius downwards. You can see here that it is completely stable. But in the example shown on the screen of a pathological case, the subluxation is quite noticeable. The two maneuvers that I just showed you for testing lateral stability are of my own design. They're not the ones used by surgeons. I will show you the two typically used by surgeons and how they could be adapted to ultrasound. The first consists of flexing the forearm like this, the palm of the hand facing forwards, and then asking the patient to push. At the same time, you could try to look at the resulting image. You can see here the radial head is completely stable. There is no sign of instability. Another standard test used by surgeons is to ask the patient to use the sides of the chair or seat to try and push themselves up. This often triggers pain and instability in patients who are unstable. Here you have the advantage of being able to evaluate the patient not only from the lateral and posterior sides, but also from the anterior aspect. The elbow is ideally suited to dynamic ultrasound maneuvers. The several examples I have shown you are by no means exhaustive, so it's up to you to find your own dynamic maneuvers. The probe is yours.